Hello, everyone. My name is Wilheimina, and I am the program coordinator for the Vaccine Education Program here at the Cleveland Minority Organ Tissue Transplant Education Program, MOTTEP for short. Our vaccine education program is aimed at increasing confidence in COVID 19 and influenza vaccines in our target neighborhoods, Huff and the University Circle neighborhoods. Funding for these efforts are made possible through grant awards from the Centers for Disease Control Foundation and Centers for Dialysis Care. With these funds, we've been able to hire community educators to attend outreach events, host vaccine clinics and workshops, as well as targeted COVID 19 and influenza messaging in bus shelters and kiosks in the greater Cleveland community. We've also been able to have commercials on Channel 5 and host this podcast. Thank you for joining us on another episode of the Cleveland MOTTEP Let's Talk About Vaccines podcast. Today we are joined by our special guest, Dr. Roderick Harris. We will be discussing the evolution of COVID-19 and vaccination efforts here in the Cuyahoga County. Dr. Harris, could you go ahead and introduce yourself? Provide us with your name, your job title, and how long you've been with the Cuyahoga County Board of Health.
All right, Roderick Harris. I go by Rod Harris, so if anybody sees that name, that's me. I've been with CCBH, Cuyahoga County Board of Health, for about a year and 9 months. I'm still counting those months as we go. I'm filling every single one of those months. And I originally came here from Pittsburgh, Pennsylvania. I was there about 8 years working for their health department. And I've been in this role just kicking it and just trying to enjoy every bit of it. This is home for me, so I'm happy to be back in Cleveland.
Wonderful.
And this is my actual dream job. I've always dreamed about being CCBH's health commissioner. I used to work here back in the late 90s, and I left to go back to graduate school because I saw that seat, and I talked to the health commissioner then, and he gave me all the advice on what to do, and here I am.
Wow,
Isn't that
wonderful.
something?
That's a great story. What part of Cleveland are you from?
I grew up on Kinsman and Martin Luther King. You know where the Aldi's is? Over
I'm
on
not
that
from
by
Cleveland,
Willow Park.
so
Okay.
no.
Well, my parents still live over there.
Okay.
So yes, that's where I grew up.
Okay, before we get started, we have a quick icebreaker question. What's your favorite place to eat here in Cleveland?
Wow. I will say the place that I've eaten at the most probably is Mount Pleasant Barbecue.
Okay, never had it.
That's on Kinsman. I grew up eating that all my life. It's still there, still kind of looks the same, and it's very nostalgic. So whenever I would come home to visit, I would go there.
Okay.
And when I came back here, I still eat there now.
Okay, so, what's your favorite thing on the menu?
It's probably not the healthiest thing for a health commissioner to be talking about, but I do like the Polish Boy Deluxes and the shoulder dinners.
Polish Boy is very Cleveland.
Gotta get my pork in every once in a while. See, you're gonna get me in trouble. And this is just the beginning.
So can you provide us a brief overview as your role as the county health commissioner, and what is the scope of the programs and services offered at the county Board of Health?
I like to describe this position as the executive director or the CEO of the county health department. But I also like to make sure that people understand that we have two health departments in the city. The Cuyahoga County Board of Health, we serve the suburbs, so anything outside of the city of Cleveland. But we do have some programs that overlap. For instance, our disease investigators for STDs, for instance, we do that countywide. But we have most of our programs just serving outside of the city limits. Our programs range from clinical services. We have an on-site clinic at our location out in Parma. Parma, yes. Well, if you want to come out to Parma, hang out with us, we have a clinic there for you. They do reproductive health services. They also do STD screenings and testing, and they also do vaccines. So that's one of our programs. We have maternal child health home visiting programs. So if individuals are having a baby or going through the prenatal phases, we have nurses who you can speak to, come out to your home, do healthy home visits. We have a lead program that's very well known. And so if individuals have a child that has an elevated blood lead level, then they can get that home inspected. We also have programs to remediate, do renovations and all that for homes. We have about 30 programs, but I'm thinking about some that people might not know that we do. And we, of course, have our inspectors. So that's what you tend to know health departments to do, restaurant inspections, home inspections, nuisance complaints, all that. We, of course, do those as well. And I would say maybe one other program that people aren't aware of is Children with Medical Handicap program. And so that program is for individuals that might have a special needs child in their home, whether it's parent or grandparent. We have nurses that can come into your home and help make sure that you have the wraparound support services to support you as a caregiver, but also that child.
Wonderful. Glad to hear the county is really involved in these different efforts. Could you tell us about your own personal experience with COVID-19? Have you ever had it? Have you ever had any family members who experienced any symptoms?
I caught COVID once,
Okay.
and it was shortly after I got this position in 2022.
Okay.
And I had gone to Essence Festival in New Orleans. I'm like, oh yeah, Superdome, a lot of people. I'm vaccinated. I got to make sure I was
Right.
vaccinated a couple of weeks beforehand to make sure I was fresh, but still, caught COVID. But I think my symptoms were very mild. I only had
Okay.
a cough. And so I didn't think I had COVID because all these years I've been, in interviews talking about the symptoms of COVID, and I didn't have those. I just had a cough and I have allergies, and I thought New Orleans, mold, humidity, no
Yeah,
big
it
deal.
could be any of
But my
those.
staff actually told me that cough sounds a little unique, and so they dropped off some COVID tests outside my office door, and yeah, there we are. But my parents haven't caught it, but they
Okay.
have been isolated. They don't really deal with too many people. They're pretty homebound, but they haven't caught it, and they have been vaccinated. But I have a brother who has been in a congregate setting for a while, and he's caught COVID actually 3 times. But
Sheesh.
he never had to be hospitalized for
Okay.
it, and fortunately, he's been in good shape. He's a fighter. So.
Oh, good. How and when did the Cuyahoga County Board of Health become aware of COVID-19? What did that look like in the beginning?
So, similar to all other health departments, we all heard about COVID when all the way over there in China, we won't have to deal with that. I think until it popped up in Washington State, and then we were starting to think. First got our case in Cuyahoga County in March of 2020.
Okay.
And so that was really early on in the pandemic, and that's when things really started to go nationwide, other than maybe a couple of states, and that's when things got pretty serious for us.
All right. So let's talk about once people got it, what were the public health guidelines that they had to follow? And like, what did that look like engaging the community to follow those public health guidelines?
That was a very difficult time, for every health department. I know at the time I was in Pittsburgh, but here it was no different. Where we had no vaccine, no one knew how you really caught it. So
Right.
the precautions were really wash your hands, mask up, socially isolate, decontaminate surfaces because we weren't sure
Right.
if it was spreading the same as flu and all these other illnesses that tend to go around in the winter seasons. And I think those were the main primary precautions at the time, but those are no different than we have for flu season. So we were comfortable with that. But at the time that everyone needed to mask up inside of, venues and all of that, and people didn't have the mask, that's when things got a little more complicated for us.
Okay. What steps did you take to get masks out to people and like really engage people to make sure they were taking care of themselves, because that's important. At this point, everyone's trying to isolate, everyone's trying to, we're running out of toilet paper, things like that.
So we have social services programs in general, but I think the medical supplies is what really was difficult for people to get, because at that time everyone needed it, and it was about who gets the priority shipments. And I think just like everywhere else, it was the hospital. So the first responders and those people who are providing care to patients, those who are getting sick, making sure that they didn't take things to their families. We have programs that were able to go and get donations. So a lot of that was really donated from suppliers that might have some supply. And sometimes it was non-traditional partners, whether it was construction folks who had the N95 masks or whatnot. We had to really get creative and make sure that everyone was on board and saw how they can contribute to the response. And I think that was really helpful.
Wonderful. Did the county identify any disparities with the impact of COVID-19 in different demographic groups? Because I think older adults were suffering a little bit more. There was the African American community, and then so on and so forth. So could you speak to that?
Well, I would say initially, most states weren't collecting data at the point where they were collecting race on this. When we have these novel viruses, just like COVID-19 was, we're just figuring out if it should be a primary reportable disease or not, right? And so I think that some of that data came later, but what we did see is that the trends that we have related to other illnesses, whether that's chronic diseases, whether that is premature deaths in general, the same communities that suffer from health inequities and health disparities were the same ones that we saw with the COVID pandemic. And those were African American communities. Those were those who have low socioeconomic status, those who are over a certain age, and also young babies. But the older adults were the ones who had the weakened immune systems oftentimes, those who suffer from other chronic diseases and comorbidities, as we call them. And those were the ones that were mostly at risk.
Okay. So could you speak more about the collaboration efforts with like the local, state, federal agencies? I think you mentioned like other agencies within the Board of Health.
So for our health department, we have to work with the local municipalities. So to give you some background, the Cuyahoga County Board of Health, we are pretty much hired by all the suburbs to serve as their health department.
Okay.
In Ohio, every municipality is obligated legally by law to have a health authority. And so that's who pays us to serve in that capacity. But with us having a city health department as well, we have to make sure that we're working with them. They have data, those residents move around. You know, at the beginning of COVID, it was always about, well, what neighborhood did those cases come in at? You know, and it's no different than any other illness that people might have. You want to know where those people are. But the reality is, and as we saw, that, you know, there are no boundaries, there are no walls that's going to keep anything in a certain community.
Right.
And so those partnerships are very key. We had to think about school districts that we were supporting.
Right.
So that involved a lot of calls with superintendents, calls from board members. We had our own Board of Health members who were getting calls from people. We worked with the state, to the Ohio Department of Health specifically, to have calls to make sure we were up to date on the information that we would then share in press conferences. So that means we were working with the county level government. It was a lot of partners that were at the table and trying to figure out how we can best serve the residents.
So what strategies did you guys eventually employ to kind of communicate critical information and also like talk to these different entities, and like how did you guys work together?
So there was clearly no one size fit all approach to this. I would say Radio One was a really good partner. I mean, they did a lot of radio ads on the FM stations, the urban and R&B stations. That was very key to reaching our community. We did press conferences, so those were a few times a week. So you might have seen my predecessor, Terry Allen, and the Health County Exec, Budish, really doing their part to make sure that residents had up-to-date information. Those will also include interviews with our medical directors. We had conversations with we have it's a preventive medicine residency program from University Hospitals and Case Western Reserve that is operating within our health department. So those residents were very key to make sure that we had the latest and greatest medical information that we can get out. They also participated in conversations with federally qualified health centers, which are low income, oftentimes community centers that serve people as primary care providers. So the list can go on and on and on, but we realized it couldn't be a one-size-fits-all approach, and different people needed to receive messages in different ways from sources that they found credible.
Wonderful. So how did you guys allocate resources? So like personnel, funding, and equipment? Because I know like during the height of COVID-19, it was hard to find people who, like even contact tracers, like everyone was looking for somebody to do the contact tracing and things like that.
I would say our heaviest cost was really around personnel, but then also equipment. Because once you started having people working from home and you started having contractors that you were employing who then needed cell phones and laptops and going out to community clinics to do vaccine clinics and testing clinics, that was the main resource stretch at that time. And everybody else was trying to get laptops and everything too, and cell phones. And so I think we had to get in line, so to speak. But the funding sources were primarily the state. Okay. So Ohio Department of Health had funding that they received from the CDC, and they would distribute that throughout the state. And so a lot of our funding, we had maybe 3-4 COVID grants that we would call them. Some were strictly for enhancing your own operations. Some were for doing community clinics. Some were for hiring nurses to go out there and do certain pieces of the work. But those funds were specifically designated for certain purposes, and they were pass-through dollars, as we call them, from the CDC to the state. Okay,
wonderful. And then were there any victories you wanted to speak to as far as the resource allocation? What were some good things that you guys were able to do with that funding and the personnel and things like that?
I would say I always want to reiterate the point that the health department can't be everything to everyone.
Right.
We do our best to leverage our limited resources. We do the best to make sure that we leverage partnerships that we have, and also see people who are non-traditional partners see their role in the solutions. So I would say creating new partnerships that did not exist. Testing partnerships that we already had, and nurturing all of them were, I think, pretty successful. We, I'm pretty sure, made a lot of people upset. Other people made us upset. I will vouch for that.
Right.
But I think we all were frustrated throughout this process, and we learned how to better prepare ourselves for the next outbreak, pandemic that might happen. We have plans in place that maybe we didn't have before, and we also have now been tested probably more than we would ever be tested. And that's very useful. So I always look at the silver lining in any crisis and never waste a crisis, so to speak. So.
Great. Well, that segues into the post-pandemic part of the interview. What would you describe the current state of COVID-19 in our county and state? I think the president announced that, public health emergency is over, but we all know people are still getting COVID. I even know people who are still getting COVID. So what is the current state for Cuyahoga County?
Well, I will say that it is no longer an emergency. And I'm glad that, the president was able to declare that, because that it helps in some ways and it hinders in some other ways.
Right.
But I would say that the current state is that we're stable.
Okay.
We have an increase during the winter holidays like we do every year with any respiratory illnesses. So you might have seen in the news where RSV, people were worried about that in the fall when people went back to school. You might have seen that flu is up and COVID has been up. But now things are tapering off as people are starting to go back to their lives and not necessarily commingling as much. But I would also say, too, that we need to be mindful of vaccines are still available. People aren't getting vaccinated as much as they were at the height of the pandemic or even when we were getting the boosters. So now we have a vaccine that's not a booster. We want to make sure people understand this is a new version of the vaccine for the newer versions of what's circulating variant-wise. But people need to still consider getting vaccinated. We understand, and we have seen over the years, that vaccines keep people from getting in the hospital and having severe illness. And granted, these variants are always evolving and morphing, so they might not be as strong as they were before, but that doesn't mean that one won't pop up. And are you adequately prepared and protected? So I would say that right now we're stable. We're keeping our eye on the situation. We have resources in place for people to keep their eye on it. We have a COVID-19 dashboard on our website. So you can see from week to week and month to month what it's looking like, from hospitalizations, new cases, deaths, all of that. So if anybody's interested in what the current state is, it's out there, and we do our best to make sure that the word gets out. I would say one more thing that we do to make sure that people know the current status is I meet with our county Department of Human Service colleagues once a month to give them a state of the respiratory illnesses circulating in our community. And I think they appreciate that. And then they can circulate that information through child cares, the juvenile justice system, foster parents, all that. So they have a greater reach than we would have. Okay. And that's another way that we get the word out.
Okay. Let's talk a little bit about vaccination. What's the current status of vaccination efforts? MOTTEP, we host vaccine clinics in partnership with Fairhill. So we're working on trying to get those numbers up and making sure people are confident in getting the vaccination, the COVID-19 vaccination, as well as the flu vaccination. So what does that look like county-wise?
Well, I think we look at the data to make our decisions. We do the data-driven decision making, and we have not seen people really coming out to our COVID clinics. Okay. So, and I think that's been nationwide, that's been statewide, and so some of those funds have been repurposed, I would say, from the state and other places. So we do have some COVID clinics right now that we offer, but it's not going to be as vast as it used to be. But also, COVID vaccines are available everywhere. Right. And so people can go out and get those vaccines. They have options, and we just let that be. We like to fill gaps. I don't want the health department to come and compete with anybody, but we are there to fill those gaps. I will say vaccines are available. We have way more than we need, so people can come out and get those. And
let's talk about a partnership, because we are looking for vaccines for our vaccine clinic coming up.
Okay, we can talk about that. And we had nurses that I think up to the beginning of this, up to this month, have been still on staff as contractors going out to homebound residents. Okay. And giving shots to individuals who might not be able to get out to pharmacy in the community to get their shot or come to our clinic. I'm not sure how long that will last, but we also have some community partners. I believe Western Reserve Area Agency on Aging might still be doing some. Okay. But I don't know. We get all these calls. But yeah, I know they also were providing some vaccines to residents who were homebound.
Okay. And then how are you guys specifically addressing vaccine hesitancy, right? There's a lot of misinformation surrounding, the vaccine and what it does and why is there another one? Why do we need a booster? Why do we need this? So like, what are you guys doing, like targeted messaging? Is it more so trying to make the vaccine available?
I think having conversations like this is going to help. We've never stopped talking about vaccine hesitancy, but even at our board meeting yesterday, we talked about how to have a required training for our staff around vaccine hesitancy, but really under the bigger umbrella of mistrust. I believe that that's really what a lot of this is about. And sometimes people are, what they say, vaccine fatigue. I think that's what they call it.
Yes, that is a new word going around.
And so I want us to get away from that as much as we can to talk about really the mistrust, because that's been going on for decades and centuries. And so everybody can wrap their head around that, regardless of what program you're doing at the health department or in the community and social services. There are people who still don't want you to come into their home. They're still not going to trust what you're giving them. They're not going to trust necessarily the information that you're providing them. So we understand that we have to approach this in a multitude of ways and reach people where they are, but also understand what their hesitancies are. Some people are just concerned that the information might not be valid. Sometimes it's the provider who's providing that information if they feel that they can trust that provider. So making sure that you have, I like to say, a multifaceted. There are many faces to what we need to do to make sure whatever these things are that people are hesitant about, we have something in place to address it.
Wonderful. So can you kind of outline the county's current strategy for mitigating the spread of COVID-19? Like, what are you guys doing about that?
So I could just speak to what we're doing at our health department. I mean, the county in general, that's a larger organization. So I think the information that I provide at these weekly meetings, for instance, with the DHS partners, they can then use that into informing their operations. I would say for our health department specifically, even though we're not doing community clinics, we will always offer those vaccines on site. I think what other people can do is, I always say that there's big P policy, but then small P policy. Like, you can do big policy changes, which aren't going to happen in Ohio per se, for certain things, but you can control what happens in your home. You can, require your whole entire family to get vaccinated. For instance, even at our health department, we still have it in our policies and procedures that all employees need to be vaccinated for flu and COVID. So what can you do within your sphere of influence to make sure that you're contributing to preventing the spread of COVID in our communities? Again, the health department can't do it all. We can't save everybody, even from themselves, but we can serve as a model, and we can also give evidence-based practices and models to people, via literature and guidance and technical assistance to help them figure out what they can do as well.
Was there any pushback as far as like requiring the vaccination to work at the health department? I know, like my former job, there was some, pushback. People were, hesitant about getting the vaccination. They didn't think they needed it and didn't want to get it. Truthfully,
right. So you're saying internally?
Internally.
That happened before I arrived, and I'm pretty sure that I've had employees actually come to me and ask if we're going to reconsider it. It's not something that I pursued with my board yet, and it's not something that my board wanted to reconsider at this time. I think that we need to lead by example, and if we're going to be the trusted resource for information, then we need to be able to talk about our own experiences. And I would say lastly, I think that employees need to understand that we want to keep them safe and we want them to not get sick when they're out there dealing with individuals who might be able to spread something to them. So right now, I think we're pretty calm and quiet. So.
Okay. Let's talk a little bit about mental health. Are there any mental health considerations that are being integrated into the public health response as it relates to COVID-19 vaccination and influenza vaccinations?
I don't know what other people are doing, so that might be the case. I was thinking more when you were saying that about my staff. We want to make sure that we have our employee assistance program available all the time. We've actually started doing mindfulness workshops. We started to do. We had our EAP program actually come on site and do some trainings on conflict and also meditations, and we have a yoga group on site that meets once a week. So we do our own worksite wellness for our employees to make sure that they're managing this. What they experienced prior to me coming was that when they were out here expected to be on the front lines, they were still dealing with things back at home, and they were still struggling, and they were still stressing. And when I took this job, they asked me in my interview what would be my first thing that I wanted to accomplish, and I said I wanted to make sure that the staff had opportunities to heal.
Yeah.
One thing we know about our community is that a lot of healing needs to go on. But now we're seeing this with all types of populations, that everybody needs to heal from this pandemic,
right.
especially those who are expected to give so much and tap into what their why is every day. And that why is oftentimes sacrificing a lot of what you are, planning to do for these residents that we serve. So
great. So how do you balance the need for public health measures with the economic and social impacts on the community in general?
Repeat that one more time.
So how do you balance the need for public health measures with the economic and social impacts on the community?
I think we have to understand that everyone's different and we all have our struggles. And one of the things the health department always did was really make sure that we're filling in the gaps, as I said earlier, and understanding that we're going to have people who don't have access.
Right.
So can they get to where they need to go?
Right.
So we were providing gift cards and incentives like that. We wanted to make sure we took these vaccine clinics to where people were, where they were coming, where they had trusted sources, whether these were faith-based organizations or not. I would say it goes beyond even just that. Even when we had the Mpox, or what was first called monkeypox, we had clinics in the community for those as well. Because again, people might not come to Parma to get these services, right? And we know, being from Cleveland, or for those who are from Cleveland, that we don't tend to do east side versus west side sometimes. So we have to make sure that we're providing something that is at least comfortable,
right,
and somewhat convenient for residents to get to. And those were, again, relying on our partnerships, community centers, recreation centers, to make sure that that's happening, and also making sure that we weren't overlapping too much within the city limits, because we would get calls from maybe county council people who represent areas in the city and outside the city. We're like, well, we can do a location outside of the city limits, just to make sure that we're respecting those boundaries.
Yeah, I think it's always important to get community feedback when it comes to public health, because they are the people who are here, you want to meet them where they're at.
And I would say too, connecting people to other services, when it doesn't go too far astray from what we do as a health department, because if a nurse goes into a home to see a newborn baby, but understand that they are having utility issues or food insecurity issues or lead problems, we're going to provide whatever information we can for those services. So that was no different. Even in our clinics, we would partner with food pantries or whatever to make sure that we had food that we were actually, they were, I wasn't there, I'm not going to take credit for it, but the staff was actually taking bags of food out to residents who were homebound because those were, shut down. So I think that it shows that we understand it's a holistic approach to anything that we're doing in public health.
Right. Are there any long-term changes in public health infrastructure or policy that you foresee as a result of this pandemic, or has anything been changed, or things in the policy?
With our department, we had to not rely on these COVID grants that we knew eventually were going to go away. Fortunately, there were some workforce development dollars that the CDC also had that they were giving to states, and so we have those funds to create positions to still continue doing some of that epidemiology, research, data pieces around illnesses in our community, shoring up our emergency response team so that if this happens again, we have people who are on staff, and so we're not caught off guard, like where we're going to get funding for contractors. We now have things in place. So I think that those resources are helpful, and those won't be around forever either. So now it comes down to me and my board making sure that we are allocating funding to sustain these positions and redesign ourselves as an organization to be prepared better in the future.
Great. Looking back, what are some key lessons that you believe you guys learned from the early days of the COVID-19 response? And so what are some lessons you guys learned? Because it's like, from not knowing anything at all to now, having more information and realizing that this virus is just mutating and spreading in different ways.
I think everyone, not even just us, learned that a novel virus is exactly that. Novel means new, is new to us. We don't have all the information. We don't know how we're going to be able to prevent, how we're going to be able to get vaccines, what the vaccines will look like. All those things were new. I think as a part of that, everything was constantly changing. I think the CDC has really got a lot of backlash about that, how the stories are changing. First, you can catch it from touching surfaces. Now you can't. First, you can use any kind of mask, and now you can only use an N95 mask. So I think that people need to understand, and what we've learned is that this is going to be new. It's going to be, we need to be agile in order to do this effectively, but also make sure people understand, here's what we know, but be very clear about what you don't know.
Right.
And I think that we did a good job about that, but sometimes people hear one thing and then they interpret things a different way. You might not have said it because you told them what you know.
Right.
But sometimes people assume you know more than you know. So we understand now that communication is left up to the interpreter.
Right.
And sometimes that can be a little difficult, but you want to be that trusted source. Some other things, I think maybe that partnerships need to be nurtured. You might have had a grant with somebody 5 years ago. You know who the person is. That person isn't there anymore.
Right.
Okay, so now you need to work with someone new who doesn't know you. I think that those relationships need to be nurtured over time. So when you need something, it's not, all of a sudden you're trying to build a relationship when people don't have time for you to figure that out. I think that's another key piece.
To wrap it up, do you think the Cuyahoga County Board of Health... Ooh, I'm getting a note from our producer.
Breaking news.
So, sorry, everyone. One second. Right. Let me read this. To kind of, make it a little bit more personal, could you describe your typical day at the Cuyahoga County Board of Health? What does it look like to be the health commissioner?
I always say this is the easiest job, but the most difficult job I've ever had. It's easy because I love what I do.
Yeah.
And because now I can coach others, and coaching is really good for me and easier for me because I've been through a lot of what they're doing. I used to be an inspector. I used to run all the clinics in Pittsburgh at their health department in many locations, and having staff in 12 different locations, and all of our staff is in one building. Like, this is very easy. And we have a nice building. So I would say it's easy in that respect, but it's difficult because every hour I'm putting on a different hat.
Okay.
And I'm also, making sure that I'm available for my team. And so I would say yesterday we had a board meeting from 9 to 11. We had a diversity council meeting from 11 to 12. I had interviews for a position I'm hiring for from 1 to 3. We debriefed that.
Sheesh.
I had, and then I prepared for this interview. And then I also have to prepare for a coalition meeting that I'm leading and facilitating tomorrow for the first time we're convening these people, but that needs to go on tomorrow morning. And at the same time, I need to check emails. I need to return phone calls.
Don't you love
emails? But again, I tend to work during the day, and then I check emails and actually, do the real work of responding to people and thinking and reading in the evenings. So it's a 7-day-a-week sort of job, but I would say that, but it doesn't seem like work to me because I'm so committed to the people. It's what I devoted my career to. And I would say doing this here in Cleveland is easier than me doing it any place else because it's home. Yeah. So I'm driven.
Okay. You keep talking about your board. Who is comprised of your board? And who, what kind of people? What kind of people sit on your board? So is it what is your board comprised of? What do they look like, and what are their jobs?
So the state law dictates that we have 5 members on our board. Okay. I don't know if it's at least 5, but we have to have 5. And my board consists of 2 physicians. Okay. And 1 lawyer. We had 2 lawyers, but one ended her term early in September. And then 1 gentleman who's a retired financial executive. Okay. And so we have a nice balance of those who can help us out with advocacy, policy, contracts, those types of things, but then also the physicians who can really help us understand the medical dimensions of public health. Okay. Because I like to say public health is community focused and population focused, and it's different than the medical model. Right. People tend to mix medical and public health, but public health is community, medical is one at a time. And so if you go, down the path of combining those, you really have the perfect mix. Okay.
What do you and your board really talk about? Well, now post-pandemic and pre-pandemic, obviously you were only here for a couple. years into the pandemic,
yeah.
but like what do those board meetings look like?
So I'll talk about what my priorities are. But the board meetings are essentially once a month, the last Wednesday of the month in the mornings from 9 to 11, 9 to 12, depending on what's on the agenda. They're open to the public, but we don't broadcast them live or anything like that. I think that might be something that we consider in the future. It's just never been done in our health department. But we tend to just get approvals for me to sign contracts. Sometimes a lot of it is just really boring work. You know, we talk about the grants and the projects that I need to sign, the agreements for. Some of these are also conversations around our EPI. So we give our monthly respiratory diseases, infectious diseases report from our EPI team, so my board can stay abreast of any of those issues. I would say we talk about any issues that pop into my mind sometimes, right? We're really focusing now on a union.
Okay.
Our employees, I don't know if a lot of that was burnout during COVID, but they have a lot of concerns that they have as an employee group. And so they voted to start a union at the health department, which is going to be a very new venture for 2024. It's going to be a lot of time consuming work, but I'm excited about it because I've never started a union anywhere. I've always just arrived and the union existed. So we're going to see what we can do to make our employees a little more satisfied with things that they're dealing with as a workforce. Some other things is really focusing on equity and diversity and inclusion. I was able to hire a director for equity and diversity.
Oh, that's wonderful.
It might have been fall of 2022. 21. Time is flying.
Isn't it?
And so I'm glad that they had that already in the budget. I didn't have to fight for it. It was already there. And so we hired that gentleman. And I think the next thing that we're going to focus on is trying to make sure that we are accommodating whatever we can to be a little more flexible work environment. Right now, everybody wants to work from remote locations and all those things that people want to do. So making sure that we're a place that people want to come and work.
Right.
And I think that's going to be a big piece of it too. That's going to come along with this whole union conversation as well.
Okay. Dr. Harris, could you share with us any important website information and where people can kind of, if they have a question or about COVID or about the services offered at the Cuyahoga Board of Health, could you direct them there?
So our website is ccbh.net. Our website is one of the things we're doing this year is revamping our website. So if it looks a little messy and convoluted, understand that we know that we need to do some improvements on our website. But I think COVID just had a lot of things getting delayed and things weren't getting as updated. But we have a contract. I just signed that contract at our board meeting yesterday.
Wonderful. For
us to revamp our entire website. I would say for other information, Ohio Department of Health, would be great, for anything that is, statewide that you might be concerned about. We do have our COVID dashboard that might be of interest. We have an opioid overdose prevention dashboard that if people want to know what overdoses are looking like in their community, many times we tend to think that it's for certain populations or certain demographics, but it's affecting everybody.
Right.
And Black males are leading in new overdoses, and that's been a trend for a couple of years now. So I think that's one of the things that we're doing. Homicides is a priority for me. Gun violence, understanding that African American boys are their leading cause of death is homicide, and that in Cuyahoga County is one of the top 10 leading causes of death for African Americans. And so that's very important to me. So I'm looking to work with the city of Cleveland and some other groups to form a coalition around that. Climate change, climate justice, environmental justice is important to me. And so this coalition that I talked about, I'm starting tomorrow, is all about how can we do more around climate action. We have these plans and these county reports on being green, but who's really doing that work and who's monitoring it? So I think that we need to play a bigger part in that. The HIV dashboard, we just had one that we have one now that we just launched this month. So we want to see what the HIV cases are looking like in your community, in your neighborhoods, then that's out there as well. So that's something new and people are really excited about that. So you can go to our website to find all of these and ccbh.net. If you have a hard time finding it, you can always reach me directly.
Wonderful.
And I can give you my email address. I'm accessible to the people.
Let the people know the email.
R Harris, so that's RHARRIS @ccbh.net. So definitely email me. I answer my own phone and I answer my own emails and I schedule my own meetings. So that's why I'm communicating with you, as much as we were.
Thank you so much for joining us today on this Let's Talk About Vaccines podcast. It's been wonderful talking to you and like getting all this information because we don't often get to talk to our health commissioner face to face. And I'm hoping that, people will tune in and people have learned something from this podcast. So thank you again for
Thank you for having me.
being
It's
so
great
wonderful.
to be back home, and it's great to be here with the people that I know and love.
Oh,
so I appreciate it.